Hi, my name's Cameron. I'll be your nurse today. I'm closing the curtain to provide privacy to my patient. Could I have your name and date of birth?
Kayla Samuel, 9/22/02.
Okay, and I just have a few questions. Do you know where you are right now?
My kitchen.
Do you know the date and the president?
4/26/20 and Donald Trump.
Okay, the patient is awake, alert, and oriented. The patient responds appropriately, obeys commands, and is opening their eyes spontaneously, so the Glasgow Coma scale is 15. Okay, I'm going to shine this light on your eyes. And then just look over my shoulder and follow my finger. Okay, the patient's pupils are round, equal, and reactive to light and accommodate to distance. And then follow my fingers.
Are you fans of chocolate and marshmallows?
Okay, the patient's extraocular muscles are intact. Could you open your mouth up? Okay, the patient's mucous membranes and tongue are moist and pink. There are no evident signs of lesions or sores. Could you smile? Okay, the patient's teeth are intact. And then open your mouth and go, ah. The patient's vagal nerve 10 is intact and the uvula rises and falls symmetrically. I'm going to assess your lungs. So have you been feeling shortness of breath at all? Okay, the patient denies a call for feeling shortness of breath. I'm going to assess your respiratory rate. So I'm going to place my stethoscope on your chest for 10 seconds. Just breathe normally.
That's amazing. They've got so many memories here.
This was Shark's nursery.
But it's time to make this house work for this generation and the next.
Okay. The patient's respiratory rate is 16. The rhythm is within defined limits, and the chest rises and falls symmetrically without the use of accessory muscles. Now I'm going to listen to your lung sounds. So just breathe normally. Breathe in. And in. On your side, so you can lift up your arm. In. And out. Okay, now on your back. In. And out.
It's hard to believe that at one point this entire area was one big orchard. And these houses, when they built them well. They're just super, super small. Small, yeah, beautiful brick homes though. Hey guys, hello!
Okay. The patient lung sounds are clear to auscultation and free of adventitious lung sounds. Now I'm going to assess your radial pulse.
Or smashing the house. The smashing face, how's that? I heard a rumor that you guys have had this house in the family since...
Okay, the patient's radial pulse is 74 and it is palpable. Now I'm going to assess your apical pulse, so right here.
Back in the early 60s, and my kids now are fourth generation.
Wow, that's amazing.
We love this area, and our kids' school is literally down the street, so they can walk.
Okay, the patient's apical pulse is 74 and there are no extra heart sounds heard. Now I'm just going to palpate it. Okay, the patient's apical pulse is palpable. Now I'm going to listen to your heart sounds. So first I'm going to go through with the diaphragm of the stethoscope and then the bell. So I'm listening to the aortic,
So in all the years you've lived here, have you ever thought about lifting up a height here or these little...
pulmonic,
There's been many thoughts.
Okay.
Well, then we just decided.
tricuspid,
We didn't know which direction to go. It's slightly overwhelming.
and mitral.
Living room, what do you think?
We don't use it very often.
Now I'm going to use the bell of my stethoscope.
Have the basement, or we spend more time in the kitchen.
Okay, so then I'm guessing the kitchen is a little more spacious.
That was aortic, pulmonic, mitral.
Very little storage, and there's a
That was tricuspid, this is mitral.
Yeah, so this is literally it for your
it stops. I sort of
Okay, the patient's heart sounds are within defined limits and there were no extra murmurs heard. Now I'm going to palpate your carotid artery, so just turn your head to the side. And the other side.
What are some of the things that you would just love to see in a kitchen?
Okay, now I'm going to auscultate your carotid artery. So I'm going to do it in 3 spots, and while I'm doing it, I'm using the bell of my stethoscope. If you can just hold your breath.
Ideally, it'd be nice to have it pushed off the wall and utilize all 4 sides of the table.
Yeah, we actually would love to have family party or
Okay, and the other side.
our kitchen other than
Just
the three
have your neck
chairs that we have there. We just want to
breathe
bring
in.
our family back in.
And the yard is huge.
Yeah, we have a big yard, so the kids like going out there.
Did you put out there?
Okay, breathe out. The carotid artery is palpable and no bruits were heard. Now I am going to assess your abdomen. So, do you care? I don't have to actually do it. Okay, so I'm just inspecting the abdomen. The abdomen is free of any scars or lesions or discoloration, and it has a flat contour. Now I'm going to auscultate it to listen to the bowel sounds in all 4 quadrants. So I'm going to start in the right lower quadrant.
Looking at how the main floor is laid out, we will definitely have to do something with some of these walls and rejig everything. What
Right
I'd like
upper
to do is
quadrant.
have a wall between your kitchen and your master bedroom and take over that whole
Left
space
upper
and make a much
quadrant.
bigger kitchen with plenty of room for that island you want.
And left lower quadrant.
Squeeze in the new master
And the bowel sounds were heard in all 4 quadrants. And now I'm going to percuss.
Okay, that sounds great.
In addition to the master, there are 2 more bedrooms on the main floor. For kids' rooms, these aren't a bad size. Plus, a decent looking.
Okay, timpani was heard in all 4 quadrants. Now I'm going to palpate. So I'm going to start with light palpation.
I like this.
Do you feel any pain or discomfort as I push?
Here because there's so much space. Oh, okay, so this is a salon in here.
Yes, that's where I work part-time.
Okay.
Okay, and then I'm going to use deep palpation.
Yeah. My mom has been doing my dad's hair for 53 years. Yeah. Now, same hair.
Okay, the patient's abdomen is soft and non-tender, and there are no masses or lumps noted. Now I'm going to palpate for your liver. So take a deep breath while I do this.
So you make sure it's still functioning.
Okay, the patient's liver is non-palpable. Now I'm going to assess your peripheral vascular system. So first I'm going to do your upper extremities. I'm going to put your shirt down.
Okay.
So you just
That's absolutely fine. There's a lot we can do. Just keep in mind.
So first I'm just looking at the color of her skin, and her skin is pink and appropriate for her ethnicity. And now I'm just feeling to feel for the temperature. And the patient's arms are warm and dry. Now I'm going to assess the capillary refill. So I'm just pressing in on her nail. And the capillary refill is with less than 2 seconds. Now I'm going to feel the radial pulses both at the same time.
I didn't think we collected this much stuff.
And that's why opening up between the master bedroom and the main area.
Okay, patient's radial pulses are palpable bilaterally. Now I'm going to do the brachial pulses both at the same time.
Well, you guys have never even known another house. This is the only house you've ever been.
And the patient's brachial pulses are palpable bilaterally. Now I'm going to do the same thing on the lower extremities.
Crazy while the kids are here, but I want them to be involved.
So I'm just looking at the color, and the patient's legs are pink and appropriate for her ethnicity. I'm feeling for the temperature. And the patient's legs are warm and dry. Now I'm going to do the same with her toenails for her capillary refill. And the capillary refill is less than 2 seconds. Now I'm just looking at her leg hair, and leg hair is present it's present and distributed evenly. And then I'm looking at edema. So have you noticed any changes in your legs at all? Okay, and no edema appears present to me. And there are no lesions, sores, or open wounds present. Now I'm just gonna assess your dorsalis pedis pulses on the top of the foot on both sides.
Mom and Dad, you're going to continue with me. We got a lot still to do. All right? See you guys later.
And your dorsalis pedis pulses are palpable bilaterally. And then your posterior tibial pulses on the back of the ankle are also palpable bilaterally. Now I'm going to do your musculoskeletal system, so just grab on my fingers, just grip them.
So,
Okay, and then flex your arms up, and just pull back, and then push forward. Okay, the patient's strength and resistance in their upper extremities are equal bilaterally. And then in your feet, just dangle them, and then push down on my arms like you push on the gas pedal, and then push your fingers up. And the Patient's lower extremities are both equal bilaterally, and that is all. Thank you.
Thank you.